Good morning, good afternoon, everyone. Thank you very much for joining us today for the monthly GDHN webinar. We're really delighted that you could join. My name is Rose Nzioka. I'm a GDHN chair, about a month old, incoming. So I want to welcome everybody for today's webinar. Trinity will be moderating for us the session, so I'll shortly hand over to her so that she can walk us through the agenda. But as we do that, just to remind everyone that the GDHN forum is coming up in early December, and abstracts will be going out soon. We'll share with you the dates as soon as we confirm them. Thank you very much, and I'll hand over to Trinity to take us through the agenda. Thank you.
Thank you, Rose, and welcome everybody. We're so happy that you're able to join us today. As with everything in life, we're going through our own technological, bumps along the way, but we hope that it's going to be smooth. I'm really excited to have the opportunity to be alongside really wonderful speakers and presenters who are all going to share their different perspectives as well as their tools and resources related to ensuring quality content for family planning, sexual and reproductive health, digital tools, which, as we know, is a very exciting and hot topic. There's been a proliferation of these tools over the past decade. Many of us know where to go to find kind of the names of these tools. There are compendiums that exist in the Digital Health Atlas, the Digital Health Compendium. So maybe we can go and find a tool. We also know that there are evidence compendiums. There are the HIP briefs for family planning that talk about evidence for client-facing and health system strengthening digital tools. There are WHO recommendations that include evidence reviews. But there aren't necessarily kind of one go-to place to talk about what you need to do or how to help you develop and ensure quality content. And so that's really the idea behind today's session. Obviously, having quality content is essential to reach the outcomes and the impact that we all hope to obtain. And so it's an extremely important topic. And so today, as we walk through different tools and resources and perspectives, of course, there's a lot of ways you can slice and dice this. You can think about different buckets of tools. You can think about provider-facing tools and client-facing tools and systems-facing tools. You can also think about resources that would help you when you're just starting, or resources that would help you when you've already developed something, but you still want to kind of check or verify or assure the quality of that digital content. And we've got a little bit of everything here. So my metaphor for today is that this is an appetizer platter. We've got something for everyone. So I'm really excited to be joined by, as I mentioned, a number of wonderful speakers. Unfortunately, one of our speakers, who is my colleague, Sarah Brittingham, is unable to join us. COVID has arrived at her home, and so she's not feeling well, but she's doing all right. So I'll be stepping in for her. But before I do that, we will be hearing from Tigist Tamrat. So I'm going to invite Tigist to come on camera. I'm going to pull up her slides. But in the meantime, Tigist is a technical officer in the Department of Sexual and Reproductive Health and Research at the WHO. So let me share my screen. Give me one moment. And we'll shift from the agenda over to Tigist's slides. So like I said, I'm hoping for a little grace here from you all. Let's see, is this working? Yes, presenting mode.
I think it's always funny because the digital webinars are always the ones that encounter all these issues, and everyone expects us to be on top of it, but this is great.
Can you see? You can see them, Tigist? Okay, go ahead, over to you.
Thank you. So just building on what Trinity had said, and thank you all for this opportunity to speak with the Global Digital Health Network. It's really great to have this panel. So speaking about quality and how important it is to really ensure that it's driving the impact that we want, we at WHO have launched this initiative called WHO Smart Guidelines, and I'll be speaking specifically about Digital Adaptation Kit. So if you can please go to the next slide. Next slide, please.
Sorry,
Kate.
I'm trying to get there. I minimized something, which is never a good idea. Give me 1 second. There we go. All right.
Great. So as many of you know, WHO, the bread and butter is developing these evidence-based guidelines, which are really important because they can tell people, what practices, or in the context of family planning, the safety of certain methods, et cetera. However, a lot of times these guidelines, while they're very rigorously developed, take time to be introduced to the end users. Either the health workers or individuals themselves that need access to this information. And part of that is mediated through the many different layers that WHO has to go through before the guidelines can actually end up in the end user's hands. And that has to go through the ministries of health that will, adapt it to country context. Then there may be implementation partners. And in the case of technology, there may be digital technology partners, software developers that will be trying to transition these guidelines into a usable app, for example. Then it actually has to go into the health workforce, the health workers that will be delivering this information, that will be using these applications, or to individuals themselves. And throughout that process, if you can go to the next slide, there's always questions about, is it accurately being done? Not because people want to cut corners, but we do recognize at WHO that guidelines are not always detailed sufficiently, that there might be some ambiguity, which leaves openings, which leaves for misinterpretations. And it's also not cost efficient for each time for each implementer, each developer, each setting to go through and digest and unpack WHO's guidelines. And it's not always like a scalable way to do that, to go through that requirements gathering process over and over again each time. And we also see that there's WHO at least a recognition that we should be pushing for interoperability and standards-based approaches, and that it may not always be easy to actually apply standards, and trying to find ways that we can help support that. So next slide, please. And as Trinity also mentioned, that there are a lot of digital tools. We know where we can go find them, or we will build them, but sometimes it's really a black box to know, with the solutions that are already out there, what was the underlying content based on, so that people can really have that quality assurance that this is evidence-based information, that it's not perpetuating myths or information that's not really substantiated by any underlying evidence. And it's very difficult to actually be able to understand this looking through all the digital systems. And I'm really excited to hear more from other panelists on other approaches that they're trying to figure out to ensure the quality of the underlying content within digital systems. But we also at WHO recognize that governments, we need to find a way to allow governments to have access to what that minimum health content should be, not necessarily in the PDF books that we publish with our guidelines, but in a way that could be more usable for digital systems. And we realize that it's not, doing either a guideline or creating an app, but that there could be things along the way, and that ways that we at WHO can help facilitate that. Next slide, please. So this is the launch of the WHO Smart Guidelines. It was launched with the blessing of our chief scientist, Dr. Soumya Swaminathan. And it's really about procedures and ways that we can take our evidence-based guidance and other documentation and provide it in such a way that it could be channeled towards the development of digital systems, and making it software neutral. So one of the things is also not just doing it for one specific application, but translating the guidelines into specifications that can then be ingested or applied for numerous software applications, and not really being constrained or promoting one specific brand of a software application. And also, as much as possible, to try to promote interoperability along that process. Next slide, please. So Smart Guidelines is an umbrella term, and it encompasses 5 different layers. The first is really going from the narrative. This is probably the traditional guidance that you all have seen, those of you familiar in the family planning space. It could be the family planning handbook, the medical eligibility criteria, the antenatal care guidelines, et cetera. And it's really trying to see how can we pick out the key things that would be needed to be reflected into a digital system. The first use case was really for a health worker centric digital system. So something like a digital tracking or digital medical record with a decision support system. But this could also, we're thinking about this also for use cases regarding like self-care interventions and applications that individuals also could use to obtain information. And starting from that narrative place, we go to the operational, and these are the digital adaptation kits, which I'll go into a little bit more detail. But this is the first step of the SMART guideline transition, in which we try to distill it into spreadsheets, into data dictionaries, business process workflows, algorithms that are spread out into into decision support tables, so that you actually have access to this information in a way that even software developers don't have to go back and read these books and say, oh, here's my data dictionary. Here are the data elements that I need to encode, or here are the algorithms in terms of the inputs. So blood pressure is greater than this. And then the output could be, that you need to screen for a certain condition, et cetera. And just making it simple and understandable like that. Then the next stage is having it machine readable. And this is not necessarily something that we as lay, or I as a lay person would understand, but it's more for the computers and the digital systems to be able to ingest as a code. So it's like lines and lines of code that would make sense to be incorporated within a digital system. And the key thing here is the use of data standards, because you need to make sure that whatever language that the code is being developed in, the systems can also ingest that. And that's why it's really important. Another key aspect of the SMART guidelines is really trying to push for the data exchange standards so that systems could actually ingest this machine readable code. And then there's the usual executable. These are the actual applications like reference apps, the tools themselves, which there's less of an emphasis on in the SMART guidelines, but we do recognize that, you can't just provide the spreadsheets or provide the code. We also do want to have a reference software in case some people are interested in that. And then big picture vision is that maybe one day we'll be able to have everything standardized so well that we can help it inform advanced analytics and do some machine learning for continuous improvements, as well as feeding back into guidelines. So next slide, please. And just to say that this is a progressive pathway, we don't think that everything will happen at once, but it's a big picture vision. I'm going to focus primarily on the second layer, the Digital Adaptation Kit. Next slide, please. So what are they? They're software neutral, and they're documentation to help systematically document recommendations into digital systems. So these are the key artifacts that software developers would want, and that health workers could act, or health program leads could review to make sure that they're in. So it's supposed to be in tech jargon, but it's supposed to be a bridging resource that all individuals that are involved in the delivery of like a health service or family planning, as well as the digital people that are the ICT support team that's helping to facilitate that within a digital system, could all review together. And it's a generic starting point because we are using WHO guidance as a starting point. It's generic, it's not localized to any specific country or setting. And the assumption is that 80% of what needs to be in the system will probably be similar across different contexts. We're still validating this assumption, but we've seen in some countries that is pretty consistent, at least with antenatal care, that the information that's recorded and the types of care that needs to be provided is usually consistent. It's just that there may be 20% deviations, additional maybe like routines that are added, or distribution of mosquito nets in some areas, maybe not others. Those types of contextual factors that may be different across different settings. Next slide, please. So just we think of this, I guess, for everyone that's on this webinar, the health content to be the most important part right now in terms of the SMART guidelines and the digital adaptation kits. And so when we think about digital health implementations, where you have the very fundamental aspects of leadership, governance, all those building blocks, and then health content is a key part as well as the application that it's going to be delivered in, which we're not really focused on for this, or the actual functionality, whether it's decision support or it's like a referral mechanism. But then that always needs to be accompanied by a validated health content. Next slide, please. And within the Digital Adaptation Kit, there are 8 key components. These are the health interventions. So this could be, for example, in family planning, this could be whether there's an insertion of IUD or distribution of condom. Like, so it's actual interventions that would be expected to be either included within, reflected within this digital system. And it's drawn from the recommendations that WHO has on what, are key interventions as part of a family planning service delivery. And it could happen at community or at, at facility level. The DACs currently are positioned right now for primary healthcare facility level, but I know that there's also interest to look at community level or even higher level for referral systems. And then also looking at the generic personas. So what are the roles of these health workers? What are the competencies? And this, again, is derived from WHO guidance. So it would have to be adapted. Maybe in some settings, health workers provide certain methods or don't provide other methods, and this would have to be adapted and then reflected in that eventual inclusion to the application. And then a brief vignette, scenarios of how the system would interact, the business process workflow. So this actually shows step-by-step, mainly to illustrate to those that are on the ICT, the digital development side, how would the family planning service delivery actually function? And then for each of those activities, so say you're taking past history or you're providing counseling, what are the key data elements? So you may want to ask questions about past pregnancy, or you may want to ask questions about methods that they would prefer, if this is a new visit or not. But it actually details, and we'll show really briefly what that would look like. And then a decision support logic. So these are the algorithms that say, if they requested an IUD and they're showing, this symptom, are they medically eligible? And it's tied to the medical eligibility criteria or other types of vetted quality information sources. And then there's indicators and monitoring, which are not necessarily developed for the DAC, but they're indicators that WHO has put out. And family planning is one of those areas where there hasn't been as many indicators as, say, like HIV or antenatal care, where there's very clearly spelled out indicators that could be obtained from routine health information systems. But this is in the assumption that, this was to link to a system like DHIS2, what would be those aggregate level reporting needs that this system would need to feed into. And then lastly, functional, non-functional requirements. So next slide, please. And just to say that we know that digital health is a very complex process, and we've developed a lot of tools, and others have also developed a lot of tools to help guide the planning and the implementation and sustainability aspects of digital health. And the content piece is really that, it's a small sliver of that broader process. Very important, but just recognizing that this sits within a larger set of issues that Trinity had also set the stage with. Next slide, please. So just overall, these are 2 digital adaptation kits that have been developed, so you can review them, and they're available in French and Spanish as well. And there are many more that are coming your way. I'm just going to quickly zoom through, if possible, and Trinity, just feel free to zoom through the next few slides just to kind of give a taste of what is actually in these DACs. So here is a deep dive into the family planning DAC, and next slide, please. So we, consolidate across the different guidance. What are some of the key interventions that, need to be considered? Next slide, please. And then some of the personas, again, we derived these from the WHO guidance, and we did some also interviews with health workers themselves to see, okay, what does your day look like, so that we can actually contextualize it. We also had a lot of discussions with regional partners and colleagues to inform this. But again, this is looking at, okay, if you're, say, an auxiliary nurse, these are the types of methods that you would be able to provide, or these would be the roles. Next slide, please. And then looking at, like, from an adolescent perspective, we've tried to incorporate a cross-cutting lens on what would this look like for an adolescent system. So this is a scenario to help illustrate that again, these are not illustrative, and it's really to help set the context for the different stakeholders that develop digital tools. So this is really targeted at the digital health developers to understand, okay, this is what that health facility interaction would look like. This is what I would be expected to use, and this is how the prompts are expected to show up within the system. Next slide, please. And then the overview of the business processes. So these are the key things as a description, high level of what happens within family planning, for example, family planning service delivery. And next slide, please. And then we provide an actual detailed, this is an overall workflow of how this would happen, but then we also go where there's pluses in these boxes, we actually detail out, okay, so what does counseling look like? First this is asked and this happens. And then, you agree on a process with the client, et cetera. And then this is what the data dictionary. So we have an abbreviated version in the PDF. And then if you go to the next slide, we actually detail out what can be coded into the digital system along with the response options and linked to ICD, the International Classification of Diseases, as well as LOINC and SNOMED, other terminology standards to really help the introduction and use of these types of data standards. Next slide. So the decision support logic. Next slide, please. And this has some animation. So next click, please. Yeah, so this is, with a heads assessment, it really tries to say input, like if age is less than this, then, conduct a heads assessment or gauge for these types of questions. Apologies, it's very small font, but these could be illustratively some types of prompts that are provided within the system. Next slide, please, or click again. And again, yeah, so this is another way that we take that really lengthy, medical eligibility criteria document and said, okay, if the method requested is a copper IUD and they're experiencing, heavy bleeding, what should the system provide? And the output is medical eligibility criteria 1, that they're eligible to use the method. So this is kind of the distillation. Next slide, please. And then these are just the generic indicators derived from other resources. This isn't specific to the DAC. Next slide. And then functional and non-functional requirements. Again, this is high level based on work with our regional colleagues and partners on what would need to be there. Like, so there should be like a checklist to make sure that the person is not pregnant before inserting an IUD. Like that would be an ideal function that was brought into this process. Next slide, and my last slide. So just people with, maybe previous slide, just in general, just to say that we are now moving into the next steps of looking into countries to actually use this and within the digital systems that are already in place, and also conducting implementation research, a 2-phase implementation research where the first phase is looking at how do we adapt this? How do we actually see how to incorporate the country-specific DACs into the local digital system? So there's like a very strong formative phase aspect of it, and then a subsequent phase, which is an actual impact evaluation, or like through a step wedge design, where we're actually now trying to measure, okay, now we've tried to upgrade these digital systems and we've gone through a process of incorporating DAC type of content, which is de facto evidence guideline content into these systems. Is it really getting us to, any more closer to those types of service delivery and data use outcomes that we want to see? So watch this space. We're just getting started, but we're very eager to kind of move this from conceptualization to actual implementation. And I think that's it for me. Next slide. Yep. So this is all part of the vision where people can really derive benefit from the guidance that we provide in digital format. Thank you.
Thanks, Tigist. That was awesome. I know some of you might be feeling like that's a lot of information. I personally looked at the family planning DAC early on and I felt the same way, but it is literally all of the information that you might need for these provider-facing counseling and data collection and referral tools. And it's an incredible resource that really does do exactly what Tigist said, where you distill down all of that amazing WHO guidance into exactly what you need. So that is one example of how to ensure quality content is you've got it right there in sort of a step-by-step process workflow process. So really encourage people, if you're working on a client-facing tool, a provider-facing tool, to check that out. I think it would be hugely helpful, particularly for those technology ICT folks who you might be engaged with. So, excuse me, I'm going to let my dog out of my room really quickly. And I'm excited now to present on behalf of my colleague, as I mentioned, who's not here with us today. I'm going to present on another example of a resource or a tool that will help in ensuring quality content. Give me one moment while I do this. I'm doing a lot of different things today, so just give me 1 second. Okay, so I'll be presenting right now on a particular activity that FHI 360 undertook on the Research for Scalable Solutions project, which is a USAID funded family planning implementation science project, where we were really interested in assessing the content of existing client-facing family planning digital tools. So again, recognizing that there are so many out there in existence, and that we, again, have information about where to find tools, and we have information about the evidence of some tools, but nowhere do we have information that would tell us, okay, this tool really does have high quality content. And so that was our goal, was to set out to find that. And in so doing, it has led us to also develop a tool that anyone could use to help assess the quality of the content of their own tool. And I'll be talking about that at the very end. So that's what I'll be talking about, what we found in our process, and then telling you a little bit about this forthcoming tool. I already mentioned that. So the way that we undertook this exercise was first, of course, to do a landscaping of existing family planning client-facing digital tools. There are many. We were looking at ones that were particularly interested in providing information. So there are lots of tools out there, some of which might be more focused on just, addressing myths as a very narrow focus, or addressing couple communication as a narrow focus, but we were looking at ones that really have the intent to provide more comprehensive information. And then we had to develop a rubric to say, okay, how would we assess the content of a tool? And in fact, that was how we initially came upon the Digital Adaptation Kit that Tigis just mentioned, because we thought maybe this would be, in fact, the rubric, but it was, of course, provider facing and highly detailed, which is very useful. But for our exercise, we kind of needed to take it up one step. So I'll mention where we landed with the rubric in a moment. But once we had that settled, of course, we analyzed the content using our medical advisor, and then we provided feedback to the tool owners to provide suggestions for how they could strengthen the content of their tools. And then we've been disseminating the findings, and now developing a checklist that anyone could use to essentially replicate this exercise. So for us, again, in the family planning world, boom, our wonderful WHO resources, everybody knows that this is what you got to go to. You need to go to the medical eligibility criteria, and you got to go to the family planning handbook. But again, we didn't want to just, it's not so feasible to tell somebody, well, just go through the entire family planning handbook to double check your content. In essence, that's sort of what you have to do. But again, at one level up, we kind of took the key content areas required for quality informed choice counseling and identified them. So those are on the left hand of the screen as what should be in every client-facing tool that intends to provide comprehensive and accurate information. And then within that, our medical advisor was able to review each of the tools and ensure that everything that is included under instructions for use or duration of protection was present. So we did our landscaping, we identified 15 plus tools, and after we did the review, these were the tools that stood out as having high quality, comprehensive and accurate content. And so today we're really happy to have Gary, who represents Cyber Rwanda, with us. But these are all really wonderful tools. So if you are interested in deploying a client-facing family planning digital tool, these would be some that you could go to rather than recreating the wheel. So I'm just going to share briefly some of the key takeaways from the content analysis for those of you who are really interested. This is very small, so I will get into it, but essentially these are listed from content areas that were the most accurate and comprehensive on the top left, all the way to the least accurate and comprehensive. And so no surprise, most accurate was complete list of modern methods, and least accurate, maybe it's surprising or maybe not, was side effect management. So just to dive in a little bit more, complete list of modern methods, again, most tools had these with the list of methods available in their context. And Tigist also alluded to this, you have WHO recommendations, but every country varies just a little bit. So of course, a tool available in a particular country would only want to list those methods that are available in that context. Very few inaccuracies or omissions, but when there were, what we found is that sometimes there was an inconsistent amount of information offered for methods. So maybe one method offered a lot of information and another method offered little information, which could inadvertently lead to some bias in choice. And one other tip that we're kind of providing to people based on this is that sometimes there was no differentiation between combined oral contraceptives and progestin only pills, but it really is important to list those out separately, particularly for certain audiences or populations of users such as adolescents, because there are some different requirements for use. So return to fertility was kind of middle ground, like pretty good. 5 out of 11 tools provided information about return to fertility for each of the methods that were available. 2 included 3 or more omissions or inaccuracies when describing the return to fertility following the use of hormonal methods. So again, most did pretty well. These are examples across these slides of some of the snippets of content from some of the tools, so you can kind of get a sense for how they might address a particular content area. But when it comes to return to fertility, again, we know in the family planning world that a lot of women have concerns, legitimate fears, as well as misperceptions about the return to fertility after contraceptive use. So this is really an important area to have accurate information. And one of the tips that we offer is, around language. So instead of using terms like immediately reversible, which people may not understand, you could use language like after removal or discontinuation, ability to get pregnant returns without delay. So these are all a combination of findings that we discovered looking across all of these different tools, and then some recommendations kind of extrapolated from those. Side effects, you might be surprised, but it registered kind of on the lower end. There was only 1 out of the 11 tools that included correct and complete information about this, and there was often incorrect information for, in particular, contraceptive pills. So for that, again, we know that many individuals discontinue or maybe even decide not to adopt a method because, again, of real or perceived side effects. And these tools really have the opportunity to provide information to help allay concerns, but also to provide accurate information such that somebody could make their own informed decision. So we feel like it's really important that these tools provide this information. And in particular, that this might be an opportunity when somebody's in an individual counseling session where they're getting a lot of information, perhaps these tools can provide that helpful reassurance after the fact, outside, either before or after or both, outside of that kind of face-to-face client counseling session. Non-contraceptive benefits. So by this, we mean things like whether it has, positive benefits on risk of a certain cancer, or maybe it reduces bleeding, and that might be something really helpful, or maybe it reduces acne. These types of non-contraceptive benefits were very rarely mentioned, but can have a big influence. It can be a big reason why someone may choose to use a particular method or not. So for that, again, the recommendation is just to include those when possible. And there are some really good resources in addition to the WHO guidelines and guidance documents. There are some other resources out there that really highlight what those side benefits, which is one way of calling these, might be. So again, after having done this exercise, we saw what a lot of the common errors were, and that's useful information. Also, this was a one point in time scan of tools. And so although I think that that's really useful, and now we have an additional data point to offer to the world. Again, if you're looking to develop a client-facing family planning digital tool, we can now say, these are tools that have quality content. Maybe you want to use that instead of starting from scratch. But what if somebody wants to do this kind of exercise for their own tool? Or what if 5 years from now, when there are 30 more tools, we want to do this again, or anybody wants to do this again? So we've now developed, or in the process of developing, a quality assessment checklist, which is really intended to be a user-friendly tool that anybody could apply to their own tool, either that's already developed or as sort of a checklist for what they should put into the content of a quality, for a client-facing digital tool. So this is forthcoming. We're actually looking for people to help us beta test this, and in exchange, you would get some consultation time with a medical advisor and advice on how to strengthen areas. So please stay tuned for that. Or if you're interested, if you have a digital family planning tool and you would like to try and test this checklist against your content, please email me. I'll put my contact in the chat in just a moment. So of course, none of this is super surprising, but the recommendations coming out of this exercise are to, of course, update the tool content regularly, because we know that guidelines change. We know that methods come on the scene. So it is, of course, important to update your content regularly and to use both the global guidelines and the local policies to do so, so that you know that you're aligned to both. Incorporating that external medical review, like we had the benefit of doing, is wonderful. We know that not everybody has that option, but when that's possible, it is hugely helpful. And of course, don't reinvent the wheel. We know that there are tools out there that can be adapted and adopted. And that was part of the thinking behind this exercise, was to be able to say to the world, look, these tools have quality content. Please do use them. And I'll also drop in the chat the links to our brief that summarizes the results, and a PowerPoint where you can then get contact information for each of those tool owners in case you want to reach out to any of them. So with that, I will now stop sharing my screen, and I will be inviting Leanne to join us, who is our next speaker, as well a technical officer from the WHO. So over to you, Leanne.
Thank you so much. I just want to make sure, okay, good, my video is showing, and I'll share my screen. 1 second. I hope everyone can see it now. Yes?
Yes, we see it.
Brilliant. Okay, well, hello to everyone joining. Thank you so much. And I'm going to be presenting on behalf of a team, the Youth-Centered Digital Health Interventions Framework for planning, developing, and implementing solutions with and for young people. And this was a joint initiative done on the part of both WHO and the Special Human Reproduction Program, but also our sister agencies at UNICEF, UNESCO, and UNFPA. So I present on their behalf. And I think to take Trinity's metaphor that she mentioned at the beginning of this, of being a menu of different options, what I'm presenting is something that is meant to kind of streamline thinking on client-focused digital health intervention development, and specifically that focused for young people in particular. And I want to start off with, I think, some lessons that were highlighted a bit both by Tigist and Trinity, and what most people who are veterans in the digital health space know, which is, that digital health investment should always be addressing a health need, not be duplicative of existing digital tools or systems, which I think Trinity was really emphasizing at the end of her presentation, be appropriate to a local context and account for long-term costs. And I think, in short, as a broader picture, that digital is not a quick fix for health, young people's health, or health more broadly, and that solutions are going to work best when they're part of the existing health system. And I present these really nicely in infographic form because they seem, especially to those who've been in the space for a while, kind of, let's say a pretty depiction of what's obvious, but these nice, neat messages came after, 15, 20 years of pilots, interventions that stubbornly wouldn't scale or couldn't scale in a financially sustainable manner, interventions digital solutions where there was a lot of hope placed on them and whose success were tied to either behavioral or health systems outcomes that they had no hope of achieving, et cetera. So, there's been a lot of effort to catalog over the past many years what works within the digital health space. And that's really what brought about the development of this framework as well, because I think that adolescent and youth health more broadly is I love the digital health space, and I love this intersection of adolescent health and digital health in particular, because there's so much creativity and so much energy, and because our young generations work so seamlessly with technology. We find that there's a lot of people, a lot of organizations who spend maybe 90% of their time working on adolescent health, for whom now digital solutions feel like a very natural complementary tool that they want to have in their toolkit. And so, we started seeing a need for this, I think, back in about 2018, 2019, right around the time that there was all this excitement around, leveraging social media influencers to reach younger populations, seeing how, TikTok could help convey messages in really, really abbreviated but super vibrant, nuggets of audiovisual content. You had chatbots, you had all the excitement around AI and machine learning, and how this could revolutionize how young people were able to engage with things in an ever-changing dynamic manner. And what some of us in the space, I know Trinity was one of the people we had these initial conversations with, is we saw this concern and this desire to make sure that the excitement around ever-evolving tech and assumptions of what young people found was cool, we didn't want that to replace what we know about grounded participatory design and implementation of interventions and digital interventions. And so that's really what led us to bring together this framework. And the framework itself grew out of this multi-step process that included a targeted literature review, consultations, interviews, a global workshop, and additional input from experts and young people. I think in total, we had something like 100 people who work in this space or engage with the space who provided input into the framework itself. On the left side, you see just a smidge of many documents and publications that have been developed over the years that we reviewed. And Tigges had that lovely slide that maps a lot of these resources and where they fall on the broad spectrum of digital health infrastructure. But I'll note that a majority of the documents, of course, were not adolescent or youth focused, but we did have this amazing benefit of being able to draw from these documents from the last 20 years, and the learnings and the classifications that had come as the digital health community was consolidating its learnings across all areas of health. On the right side, you see just an idea. We did we wanted to make sure that we were taking what you see that's not really youth specific, and that we were building on the best practices when it comes to designing and developing programming with and for young people. And there's been amazing learning in the adolescent and youth health field there. So we wanted to kind of color the digital health findings with the youth-centered perspective. And so we had the great fortune to be able to reach out to our colleagues in the space, to ask them to share their experiences about what they perceived as being successful practices and best practice for developing interventions with and for young people. We wanted to understand what had worked well for people, what hadn't worked well for people, and make sure that we were kind of carefully identifying challenges, lessons learned, best practices along the way. And we were very fortunate that, we got to draw from groups like FHI 360, May, Love Matters, YTH, and we asked these groups to share very specific experiences that happened with the programs that they had developed. And so not only were we able to overlay these experiences and these youth-specific learnings onto what we saw as being this, nice development process from start to finish, but where we could, we featured a lot of these as case studies, and where some of these partners had documented these learnings, in the form of, different tools or instruments, we wanted to make sure we featured those in a repository. And so that leads us to what you see here on the slide itself, which is the framework and is an illustration of the process for developing youth-centered digital health interventions. And for anyone who works in the space, and I would argue probably for anyone who's worked in development broadly, a lot of this should look quite familiar. I always say this is just what responsible, intervention design looks like, whatever your field. What sets this apart from some of the other resources that we've seen here is that it is uniquely focused on youth-centered interventions, which is described in detail in each of the sections themselves. And this process kind of serves as the foundation of the guidance and the organizational structure. So what you have, and there we go, is you have specific principles that are addressed along with some cross-cutting actions that should take place at every step. And then there are chapters that address planning, developing, and implementing themselves. One other thing that I point out is that there are these bonus annexes that were actually late stage additions, again, while we were in conversations with the myriad folks who were involved in developing this. One of these was specific considerations for funders, because what we had from a lot of people who were sharing their experiences with us was saying, look, I know what good practice looks like, but I can't do good practice because I'm on grant timelines, or, I can't, it's to do something rigorously and intentionally takes time, it takes resources, and I can't get my funders on board with that. And so we had the opportunity to talk to some funders, including some of the folks on this call, to try to get the perspective of what donors are looking for, and what kind of specific lessons we can apply specifically to folks who fund these projects. And so we have an annex that is 1 or 2 pages. That's, if you are a donor, here are some things you may want to note. And then the other thing, one of our other annexes, is on young people's perspectives on youth engagement. And we were extremely fortunate. Our colleagues at UNESCO and UNFPA had done a really great forum called the Switched On Forum that focused specifically on this intersection of young people and technology. And so we pulled together probably about 40 of the young attendees there who were influencers. They were in pre-service and in-service health professionals. They were community liaisons. They were creating their own content. And we just asked them, you've been drawn upon by the international community at various points. And when has that looked good? When has that engagement felt good and collaborative, and when has it not? And they shared those with us, and we tried to capture those in that special annex in the back. So some very simple do's and don'ts, which I'm happy to talk about further if that's of interest. I just wanted to show you one snapshot of what one section of the document looks like. We have very intentionally kept these super short because I know we all in this space tend to be drowning in resources. And this is one example of something that's in the launching phase. So this is how to do a phased launch. And each section, you saw the developing sections, you saw the planning ones. Each section kind of has the same format. So we start off by talking about what the step itself is, a quick definition, as well as then moving into what current practices look like, showcasing key tips and warnings. Again, these are coming from the implementers themselves, things that they've learned. And then we have a repository of resources for folks who want to learn more or want to do a deep dive in that place. For some sections, that list of resources is longer than in other sections. Where available, we also feature case studies, which are, again, some really just practical examples where in our discussions with different providers, we realized, organization X is actually doing a really great job, is walking the talk when we say, what does a phased launch look like, or what is human-centered design? What does that look like in action? And so we worked with those partners to find abbreviated ways to kind of tell the story of that piece of their development process. And I'll say that I don't think any of these sections are longer than 5 pages. So we've really kind of worked to bring it down to about as short as we possibly can. So this, we did, I think, a soft launch back at the very end of 2020. And so between 2020 and 2021, we've had the English version come out, as well as subsequent versions in Spanish and French. And when asked how we want people to use this, I think that it's really important to state that the purpose of all of this is to help, designers, developers, and implementers, researchers, and funders thoughtfully be able to plan, develop, and implement effective youth-centered digital health interventions in a way that is participatory. So when we're approached by people who are new to the space, let's say people who spend most of their time working in, say, adolescent or youth health broadly, and know that digital should be a key component of how they're reaching their young communities, we say, okay, yeah, this is something that you can maybe read from start to finish and see how you can develop digital interventions for this target group sustainably and responsibly. But a lot of people aren't new to the space. A lot of people are at various stages in trying to develop or improve upon their digital health interventions. And so the hope is that, at whatever stage you're at, you can find a quick overview, take away some useful tips and lessons learned, and then also be referred to, whatever the definitive document in that space is in that repository of information or additional resources we have at the end. I can post a link to where all of this sits after, or you can access it through that QR code. But as mentioned before, it is available in English, French, and Spanish, and I'm happy to answer any questions. I'll hand it back to you, Trinity. Thanks so much.
Thanks, Leanne. That was awesome. I hope that y'all are getting a sense of all these delicious appetizers that we have for you. So, we've talked about resources for provider facing and for client facing, and tools that you can use at any step in the process. And I think Leanne just really aptly noted this particular resource is really great for wherever you find yourself. And I love how user-friendly it is. It really is intended to be light and direct and practical. And I think it should get big shout outs for having achieved that. Also, I love that Leanne mentioned an important perspective that is a great segue to our next speaker, which is really what is the role of funders in this space? How do funders think about quality content for digital tools, and how do they work with grantees to really ensure that quality content? Before I invite our next speaker, I just want to make a note that if you have any questions for any of our speakers, please do go ahead and put them in the chat. I'm collecting them, and we're aiming to have at least 15 minutes, we hope, at the end for discussion. So I'll pose those questions to our speakers. So with that, let me please invite Anand Sinha, who's the India Country Advisor for the David Packard Foundation. So over to you, Anand, to share your perspectives on this important topic.
Thank you so much, Trinity, and thank you to all the speakers. This has been an amazing learning session, and I think it's an amazing exposure to a set of tools that I know that are being used, but I'm hoping we'll see much wider circulation and awareness. So to talk about, I guess the funder's role. One of the things as I have been sort of listening to people speaking here is. Oftentimes, the identification of a digital tool or a digital innovation and a platform, the issue of quality enters in quite late. It's oftentimes more about issues like creativity, scale, momentum, innovativeness. That become the basis of identifying some of these platforms and tools. And I think, in our experience, we found that many of the partners that we work with don't come from a public health background, don't come from a health background, do not even see themselves as necessarily being, that being their role. But what they have on offer, or what they bring, is significant creativity or a significant reach and ability to connect with young people. And oftentimes it's an ability to connect with young people and center their voices and listen to them and provide them the information that they need. And that is often the more important starting point. And it's one of the starting points that a number of our speakers, and I know Leanne has talked about it, is sort of just the whole issue of being centered around youth. So if you look at platforms that are sort of, starting there, starting with an engagement, starting with a conversation, starting with a place that young people come to already or seek information from, But then you're dealing with, a content creator or someone who runs a platform who doesn't necessarily see their job as, being to provide health information. But eventually they feel that, no, this is where, this is what young people are asking for. This is what young people, need more information about. This is where I'm getting my questions. And so, they'll often come to a funder and say, if this is aligned to your priorities, I can help, or vice versa. We go to them and say, listen, you're doing amazing things. What about adding in, content around reproductive health? That might, that might sort of add to the breadth of what you do. And so the point I'm making is that, the starting point around reproductive health, and especially when it is, I think, especially when it is sort of, client facing or user facing versus what we've heard about, sort of being provider facing, really means that, the need for quality content is extremely high, but you're dealing with perhaps with owners of a platform or people who are creating a platform or a tool who don't necessarily have that set of skills or even interest in that. And I think that's something that we have seen a couple of times. I know that there are a couple of examples in that list that you were showing, Trinity, of organizations who do have sort of high quality content. And I think, Love Matters and Ask Nivi are some of the partners that we have worked with as well. And yes, they have amazing content and really high quality content, but the journeys to sort of getting there have been lengthy journeys where just trying to understand and center the issues around quality, and I think the other thing just to be mindful of is that we've recognized that quality is often of two types. One is just the technical sort of, the technical appropriateness and correctness of the content that's being offered. But there's also a lot to do with just sort of some of the style. Is the language right space? Is the language respectful? Is the language sort of inclusive? We often find this as well becoming something that often requires attention, especially for people who are maybe new to sexual reproductive health and rights, as they sort of lend their digital platforms or their digital tools to some of these issues. And again, I think one of the other things that I think, again, Leanne has sort of referred to this, is that what you're trying to do is trying to put some of this content, which is oftentimes very heavy, very technical, into platforms that is often very, very different in sort of the nature of what they are. Some of them are supposed to be very, very conversational, very engaging, very cool, very, useful, and so don't necessarily lend themselves to that heaviness of the content. So what happens when you're translating, and what happens in that potential loss of fidelity, as it were, from those technical guidelines to these sorts of platforms? Again, we have a partner who's doing a lot of work with a number of dating sites to talk about how to sort of integrate information around consent, around contraception, around planning, around conversations between partners, etc. And again, it's often very, very difficult for them to take a lot of this content and just sort of copy and paste it. There's always the need for some degree of translation so that it fits in within the context of a platform like that. And so, again, so what is it that donors can do? I mean, I think, one of the things that we most often do is offer connections to experts. We are fortunate because, again, many of the partners that we work with are organizations who have deep, deep expertise in the area of reproductive health. And we've often found that this partnership works really well because, many of the platform owners of these digital tools are very clear that this is not my forte. This is not what I do. Please, please show me the way, and please, provide me the connections with the experts who can do that. So I think one is the experts, but I think the other thing is just the connections with tools like the ones that we're seeing today. And in that regard, we did do a workshop recently with all of our partners in South Asia who work on digital platforms, or who are even thinking of working on digital platforms, to sort of just expose them to the youth-centered digital framework that Leanne was talking about. And we know that we found that to be extremely useful. And so I think some of those partnerships, I think the other thing is just, again, and I think this was in the chat as well, someone pointed out the fact that, oftentimes we don't have the time or the resources, but I think it's if you're looking at bringing together two different sets of expertise, the expertise that lies on the digital engagement side and the expertise that lies on the SRHR side, they don't necessarily always come in one package. We're trying to sort of build some of those connections. As donors, it's important for us to therefore invest in and sort of enable those connections to be made. And if that's, that's possible, great. But then the other thing is just to invest in building capacity and making sure that, people who are the creators, who are the owners of these digital platforms, who are the influencers, who are, the ones who run these chatbots, who are the technology specialists, have the abilities to sort of, delve into and begin to understand the SRHR field a little bit more and understand some of those nuances, because it takes a lot of time to, I think, just understand what those are. And I think just the final point I'm going to say is that also one of the things that we have been thinking a lot about is also just to be mindful of the issues around privacy. I don't know if that's somewhere covered in here and I haven't missed it, but we do recognize that there's a lot of conversations, there's a lot of sensitive information being exchanged, there's a lot of just the questions that are being asked. Forget about the information that's being provided, just the questions that are being asked by people online is sensitive in nature. And I think one of the things that we felt is that there is a need for some kind of guidelines and guidance to understand what are the gold standards for privacy as you're developing these sorts of tools and potentially collecting information, potentially hearing from people who are asking for information as well. And I think that's, again, one of those things that we've been emphasizing a lot on with our grantees is think about privacy and what that means in all its avatars. I'm going to end there and hand it back to you. Thanks, Trinity.
Thank you, Anand. Oh my goodness, I feel like you just touched on so many important points. I really appreciated you honing in on sort of the contributions of donors and also recognizing these different types of expertise that necessarily need to come to the table and how sometimes we can be in tension. I think we've seen that in some of the comments that have already come through, and I'm thinking that Gary will also speak to that. Like, how do you maintain this constant stream of like engaging, content that needs to be produced quickly while also ensuring quality? That's not easy, and it does require different folks to come around the table. And thank you also for raising the privacy aspect. I think we'll circle back to that in the discussion because I think you're right. We need to spend a little more time on that. So thank you so much. I would now like to invite Gary Lane, who's a content writer for Y Labs. And Gary has the unique, I think, experience of, out of all of us, being the person who is working on developing this content. So probably more than anybody, he can tell us about all of the trials and tribulations involved in ensuring quality content. So over to you, Gary.
All right, thank you, Trinity. So I've only got 10 minutes. I don't think it's enough time for me to really be detailed and to tell you all the juicy stuff. So if you want to catch up afterwards, just reach out to me on LinkedIn or something. So I've been leading the content of Cyberanda at Y Labs for the past 3 years, almost 3 years now. And if you're not familiar with our work, Cyberanda is basically a platform that is made up of two main things: a pharmacy where young people can go and order different products, condoms, contraceptives, HIV test kits, that kind of stuff. We also have the content part. The content part is divided into 3 parts. So we've got the stories that are in form of seasonal web comics, and I'm probably going to start by talking about that just because it's what young people really like the most about our platform. And at the moment, we're now reaching the 4th season. So to get to the final version of the content that we get to illustrate so that young people can read them, it's an intense process that involves so many people. I mean, it can get up to 60 people for just 1 season. But don't freak out. It's not as complicated as it sounds. And there is a way to sort of like manage all that. So I'm going to talk now through the whole process from start to finish so that you can understand what I mean. So I begin the stories with a general outline about what happens in the story. I call this a character journey. But right before that, I organized a light workshop with young people, 5, 6 maybe, boys and girls, 12 to 19. It can vary. And it's basically me asking all sorts of weird questions like, what is the most embarrassing thing that happened to you or someone in high school at your school? What would you do if you saw your girlfriend with a condom and you've never had sex? So I have an idea of a story that I want to tell, and I want to know how young people fit into this. How can I make it more interesting, more relatable for young people? You really have to think about that before you go so far into the story. So I've got my outline, which is just for my own eyes. Now I get to be more detailed. I split the outline into issues. And so right now, each season has like 2 volumes, and each volume has 6 issues. So what's in those issues, I call those treatments. They're an extension of the outline, and they are very detailed. I get quite specific about what's happening in the story. I include barriers young people face when they want to practice some behavior, say using condoms. And then I also integrate some behavior change techniques to tackle that particular barrier. When I'm done doing that, the treatments are then reviewed by our internal team of technical experts in SRH, behavior science, and gender as well. So I implement their feedback and then send them to our funders and to our local implementing partners as well. So when they've provided their feedback and I've implemented their feedback, I go back to young people. I'm like, what's up, guys? What do you think of the story? Does it click? Do you like the characters, the choices they're making, the challenges they're facing? Will this really happen? Would you do the same thing as this character in this situation? What would you do differently? And what's really your takeaway from this story? Because that's really what matters at the end of the day. I love it when they say something like, geez, these folks are doing this thing, kind of makes me want to do it. Or, is that possible? Can it really happen? So when I hear that, I'm really, it makes me really happy because then the story is having an impact. I remember this one time last year, I think, we were in a workshop and we were reading a scene where a character goes to get a morning after pill. And then the guy in the workshop was like, is this really possible? Like, really? Can you actually get a pill and can it prevent you from getting pregnant? So then I had to explain to the guy how it all works out, and seeing the amazement in his eyes, I'm like, this story, people are gonna love this story and it's gonna be bringing them something new. So anyway, so from there, having implemented young people's feedback on the treatments, I now go to what we call the technical working group. This is a tough one. It's made up of people from the Ministry of Health, Ministry of Youth, Ministry of Gender, other NGOs, all sorts of experts really. People who've been in this field for a long time, who work with young people on a regular basis and are always out there on the ground. They can be from 20 to 30 people in total. So we spend like a week together going through the stories. If they don't approve the stories, I cannot write the stories. So right now, like I said, we are at the 4th season, so obviously they've approved the previous ones. When this is done, that's when I start writing the scripts. And these are what we send to the illustrator to begin the illustration process. But before that, the scripts are reviewed by our Y Labs team, and then by our funders and partners, and finally by young people. Basically the same process for the treatments, minus a technical working group. I know. So that is like the whole process. I should also say that when a story or when that kind of content is reviewed by these many people who are technical experts, but not writers. In fact, let's face it, for the most part, they're not really concerned with whether it's a good story in the sense of, would you enjoy this story on a weekend? No, that is my job. I'm looking at that. They are mostly looking at technical things. Is this culturally appropriate? Doesn't that interaction between that boy and that girl reinforce this power dynamic or this gender thing? So when it's reviewed by this many people, you risk diluting the story so much so that it sounds like, I think, a manifesto or something. And what young person likes to be told, do this, don't do that. You risk ending up just saying, I want you to strictly follow this or your life is going to hell. I mean, that's kind of what you're saying in the end, but how you say it matters a lot. So be very careful. Do not sound so technical. And also, this is very important. Give yourself enough time to develop this content. It is not something that you can just wake up and decide to write down and that's it. No. If I think our process right now from start to finish, it takes us about 16 weeks, quite long, but I'm the only writer. So you can get multiple writers if you're really tight on schedule. Just do not rush it. And I know that it's uncomplicated, but it's worth it. I just remember that one thing I could have done probably would be to show you how the content changes. So for instance, show you like the first draft, show you how it changed when I implemented the feedback from our partners, from the technical working group, and then show you how the very final version, once it's been reviewed by young people. When you compare those three and you look at them, I'm telling you, you're like, this is worth it. All this process is worth it. So that's it for the story. That's what we do for the story. It's a very intense process, and it doesn't really allow us to create these stories regularly or very often. So we have an advice column for that instead. The advice column comes out every week. It comes out every week. So young people send in questions, all kinds of questions, and we have personas two personas on our website, on the platform, Tony and Sandrine. So they send in questions like, my boyfriend keeps asking me to visit him as this house. What do I do? Questions like, there is this guy in my class that I like, but I have no idea how to tell him. What do I do? So then these questions are then answered by a technical person internally, and then I go over them and make them sound friendly, relatable, kind, youthful. So those are only reviewed internally and also by our local implementing partners. That's why we are able to produce them per week. And that sort of like makes it easier for young people to also keep coming back to the platform, because there is always something new every week. We also then have FAQs, frequently asked questions. Those are produced every 3 or 4 months there, just because you can't really always, there is mostly nothing to update regularly. And then finally, of course, this is not enough. 1 week can still be a long time. Some young people talk to them and they're like, we want to ask a question and get an answer like right away. That's almost impossible. So right now we are sort of like developing something else, a different kind of content that addresses emergency situations. So these are content that are fixed and always available on our platform. And they could be addressing things like, I got pregnant, what do I do? And they sort of like show you exactly what you could do. Or I'm being pressured to have sex. And then, on the website, you see all the things you could do in that situation. And in that way, if someone comes to the website with a question whose answers needs to be immediate, then they can access it. So that's it. Exactly 10 minutes. I was counting it, probably a few minutes late. But if you have any questions, I'm around to take them. If you also want to catch up afterwards, I'm around. Thanks.
Oh, thank you, Gary. I'm loving this real talk. I knew that you were going to tell it like it is. So you've already got a request to connect in the chat, so check it out. No, in all seriousness, thank you. I think that was exactly a wonderful culminating set of remarks, because you really pulled together all of the different threads. You told us about your process that illustrates how you have to balance centering youth, their needs and desires, the need for creativity alongside technical review, and how difficult that can be. And a few takeaways that I heard are, A, you have to have the time. It takes time to have all of these different inputs and reviews. So yeah, we might be able to do some things here and there to reduce that time, but you've got to plan and allocate for some time. But you also have the option of different types of content, which maybe require a little less of that review. So I heard different review kind of requirements for your different types of content. And that seems so smart, so that you can take the 16 weeks that you need for these seasons, but then you can also do your weekly advice column. And then you can also have this sort of on-demand kind of quick answers. And that seems so important. And I think it just reinforced what Anand said, which is, again, the importance of having different voices at the table. So you can have technical folks review things, but we need you to make it sound good and not preachy and not boring. And so, yeah, we've got to have different people coming to the table in order to achieve a product that's going to be accurate and of high quality, but also meaningful, and therefore result in the outcomes that we hope to achieve. So thank you so much, Gary. I'd like to invite everybody to come back on camera. I wanted to also invite all of our participants then to put any questions that you have in the chat. I think there have only been two. Florian Tigist is going to answer yours in the chat. And I responded to one already. And so for that, I think I'd like to, while we wait and see what comments might come through the chat, I wanted to ask a question that Anand raised about what are the special considerations around privacy when thinking about these client-facing digital platforms, and if we can, what is the intersection with ensuring quality content? So are there any special considerations around how we maintain privacy for users accessing this content and how we ensure that that content is of high quality? Are there any tensions there? Or if not, just bigger picture, what are, given that you all are experts in this domain, what are some of the key considerations regarding privacy that you would want to raise? And I'll just open it up for whoever would like to answer. Anand, do you want to kick us off since you raised that question?
I mean, I guess, you know, we know that there are, you know, sort of, I think there are these large global standards of privacy, you know, the European, the EU has one, and those, you know, I think those we take as sort of, you know, the universal tenets of privacy, especially if there is information being exchanged. If you're just, but I just feel like, you know, there is a growing sensitivity towards the fact that everything that we do online is potentially, you know, exposing ourselves, right? And I guess that's a concern about young people. And this, and I don't know the answer, but it's a conversation we've been having more and more with many of our partners, is saying, you know, fine, we had this great chat, right? You had this great discussion within a small group in a chat room, right? And you talked about XYZ. Now what, right? Is that data somewhere? Has that data been recorded? Okay, I was on a helpline. I had a helpline talking about, you know, someone who wants to find out about an abortion, right? And that person asked in the third person. Great, that was safe, right? But so, you know, is where is that in? And you know where the interaction comes in with quality is that this happens specifically with relationship to a helpline on abortion services, where the partner said, you know, we have all of our call data being monitored by experts to make sure that the quality of our advice is correct. And I just didn't know what to do at that point, because I was like, there's a one-on-one conversation about someone who's seeking an abortion, and that call is now going to another panel of doctors who's listening in. What is happening with respect to privacy? Is that even, you know, are we being respectful of that or not? And I guess that's one, you know, I guess that's where it's sort of emanating from. I'm just sort of, given the, you know, the set of experts who are here, I don't know if there is any thinking around that, or if there's some work to be done around this.
That's a great point and a great question, Anand. And I was having that same thought, that it really is, there is this desire for quality assurance, which sometimes requires us to kind of review personal information and data. And so where's the line here, and sort of ultimately what trumps, you know, that? I don't know if others would like to chime in with your reactions to that.
I mean, I can just say I'd be curious also with any insights Tigist has. I know from looking at, just because they're dealing with data at a systems level as well, not just data coming from a client, but I mean, you know, the concept of safeguarding and how you safeguard was something that just came up constantly in the digital and young people intersection, because, you know, obviously, I mean, we're dealing with the meta issues on the one hand that we're all dealing with as consumers and users of digital products in our personal lives, of, Facebook knows more about me than my family possibly does. And, based on my Google search history, you can probably put together an interesting profile of me as a human. So there's a sort of intimacy that we've all kind of accepted as the price of admission for using a lot of these services. And now we're scrambling on that meta level to try to reclaim some of our maybe autonomy, or at least a knowledge of how our data is being used. But then you factor in, legal ages of maturity and sort of how we do right by, people ages below 18 or sometimes around that area who are relying on being able to access services to the full extent of the law and be able to get support. And I think that was something that came up quite a bit, because similar to what Anand said, you have in a lot of cases people who are operating with the best of intentions saying like, oh yeah, we want to be able to track this information so that we can constantly iterate and develop. And we're saying, yes, that's exactly what you want to do. You want to do like constant iterations, and we support this, but please tell me that that is not associated with the phone numbers that this is coming in from, or, whatever it is, God forbid, names and identifying information. And so I think that there are some like low hanging fruits that might be easier to address. Like, for example, some principles of how you like overlay, for example, privacy in the context of a human-centered design approach, how you, anyone coming from the research world knows a bit more, like understands this, like these are the principles and these are the obligations we have to protect research participants. So I think that there's a bit more we could do, say, on the designing side of saying, it's great that we're doing this iteration, but here are some things that we should all agree that we do to protect users in that sense. But the bigger questions about, are there norms, are there UN-based norms that need to come out that talk about this is how data should be used? I mean, that's just such a meta question that, as far as I'm aware, is still being discussed.
Yeah, and maybe I can just also add that those are really great points about the data piece. One of the things that we're also struggling with is the onward use of data that's collected in the context of service delivery, and then if it ends up going towards informing future research, and how do you communicate that? Because the usual answer is like, well, it's going to be anonymized, or we're not really going to let people know. And one of the things that we're now trying to do is find a mechanism to go back into the systems and say, even though this is being collected on a digital module, we should, and it's in the context of service delivery, we should try to find a way to communicate and ask, how will this information, if they provide consent for this information to be used beyond the context of providing those services. And I think one of the challenges is, how do you even communicate consent and onward use? I think that like cognitive understanding of what consent means is something we're also struggling with. But I think this is something that we just have to continuously learn from. We're trying to borrow principles from the European policies that also come out, on these types of issues.
I'm so glad you mentioned consent, because there was a comment that came through about that, and I was thinking the same thing from the research domain. But it is also it's a nebulous concept, and particularly if you're talking about younger people, what does that really mean? How do you do that in a way that makes sense? And Gary, I'm not putting you on the spot, but I don't know if you have any insights into that, and if you all have a particular way in which you convey kind of how information is going to be used from the young people who are engaging with Cyber Rwanda, or any general thoughts that you'd like to add regarding privacy.
Yeah, sure. We do have some sort of guideline about privacy, some sort of policy that is internal. We do make sure that any person who is going to be in contact or in touch with young people has been trained on how to address any issues that might arise, or if a young person might approach them and tell them about a sensitive thing. We also make sure that young people know that if they are making any orders through our platform, and no identifying information is going to be collected. And even during our research check-ins, we don't collect or keep any records, any personal records. And so we make sure that they know all that. And then before all the workshops, or before we really speak to young people, or before we even engage them, they have to sign some consent form. If they're above 18 years old, it's straightforward. We just explain things. But if they are below 18 years old, the consent form is signed by them, but also by a guardian. Usually that tends to be someone at the youth center if you are meeting those young people at youth centers, or a head teacher or a principal at their schools.
Awesome. Thanks, Gary. Yeah, and even that, I know that we all struggle, again, folks who are engaged in the research domain struggle with that trade-off of what are the risks associated, also with even asking for parental consent for particular activities. So it's really difficult, but I appreciate Anand for putting that on the table and allowing us a little bit of time to talk through it. At this point, I'd like to just thank everyone, thank our wonderful presenters and speakers today for really whetting our appetite with our appetizer platter, and thank all of our attendees. I hope that you all found it interesting. Several of us have put our information in the chat if you'd like to follow up. And my understanding is that as per usual, this recording for this will be made available on the GDHN website. So with that, I'll say good night to Anand, who's staying up really late, and good evening to the rest of you. Good afternoon. Thank you so much.
Thank you, everyone.
Thank you.
Bye.
Bye-bye.
Thank you all. Thank you so much, Trinity, for amazing moderation.
Thanks, Rose. I was asking Carrie about getting the chat, and I'm realizing I don't actually know how to save it. So if you, save chat, haha, it appeared.
You
Nice. Yeah.